Hi everybody, my name is Joe Scott. I'm the President and CEO of Jersey City Medical Center. Welcome to the Medical Center Show. Today we're going to talk about orthopedics. We have one of our premier orthopedic surgeons with us today. He actually specializes in hand surgery. So I'm excited about talking about orthopedics today, and we'll be back in a couple minutes.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Hi, I'm Joe Scott. Welcome back. Today we have with us Dr. John Capo. Dr. Capo, thank you so much for being here. Dr. Capo is the chief of our orthopedic hand surgery department, and we're so excited to have him at the medical center. Dr. Capo, tell us a little bit about your training and your background and how you ended up at the medical center.
Joe, it's a pleasure to be here, and I'm excited to bring hand surgery to Jersey City Medical Center. My background is, actually I was an engineer undergrad. I don't know if I've shared that with you, but I worked for 2 years as an engineer, then realized I'd be bored doing that forever. So I went to med school actually in New Jersey at Robert Wood, and did my residency at Penn State in orthopedics, and then I did a hand fellowship out, kept going towards the Midwest in Indiana. Indianapolis, there's a big hand center out there, 6 hand fellows, 30 hand surgeons, big place. And then I actually did a traveling fellowship in Europe and in Canada for fractures of the upper extremity.
Wow.
And I was at University Hospital over in Newark for about 10 years, and we worked together at Jersey City for a while from there. And then recently, as we've ramped the hand division up in orthopedics, I've switched over to NYU. I'm full professor at NYU, and I'm happy to be at Jersey City.
So you do work at NYU in addition to having an office in Jersey City. You don't really need to go to New York to have your hand surgery, right? No,
that's exactly right. The real reason is to keep an academic affiliation. So my jacket says NYU on one side and it says Jersey City on the other. And I'm actually in New Jersey more than New York. But I'm a professor there, as I said. We have fellows, we have residents that are there. But they're actually, it's interesting, they're actually very excited to come over to Jersey City to help me and do work there, because some of the stuff we do at your hospital is actually more interesting and more complicated. So it's a nice arrangement, and they're happy to have Jersey City as a
So as part of your affiliation with NYU, you're working with them very closely, you're going to bring the teaching program over to the medical center. So we'll essentially have the NYU orthopedic teaching program at the medical center, which is just a great thing for us and all the doctors that work there, as well as the patients.
Exactly, and as you know, my 2 partners are also professors at NYU, Frank Liparachi and Kiem Lomas, and they're going to work with the residents too. So it's like New York academic medicine on this side of the river.
On the campus, great. So let's talk a little bit about hand surgery. So there's not a whole lot of hospitals that really have a hand surgery center. Tell us about what your plans are for the medical center, and actually really for the state of New Jersey, because there's really not a dedicated hand center at this point, right?
That's true. That's true. You know, it's one of the specialties that hospitals are having a hard time keeping the hand service there, because it takes a certain amount of expertise and training, and also work. You know, there's having hand call 24 hours, 7 days a week is difficult, and we've been fortunate to have orthopedic surgeons and the plastic surgeons at Jersey City work together to create this hand service. And there's several hospitals that don't have hand coverage, and it's difficult. The hand is complicated due to the tendons and the nerves and the arteries, and it's actually a national problem that the Hand Society that I'm a member of has set a task force to try to sort it out, to how to get hand coverage for hospitals throughout the country. So we're fortunate to have one.
And so we're going to have a specialty center We talked a little bit about this. Because hospitals have trouble having enough hand surgeons for coverage, we'll end up getting patients transferred from other hospitals into our hand center, specialty center at the medical center.
That's our goal. You know, we want to provide the expertise, and we're here. We're already getting, you know, phone calls, transfers, patients coming in.
Wow.
And a lot of them, I've had many patients, you know, to say that they're extremely happy that we were here. I have a nice gentleman that works for the city of Jersey City that had a work-related injury, and he, I just saw him last week, and he said multiple times, "I'm so happy you were here when I came in and I was on calls," and he's done well.
So, you work in the trauma center. Certainly, there's a lot of hand injuries related to industrial-type accidents, those kinds of things. But what are the most common things you see in our emergency department?
It's you know, the hand is very complicated, as I mentioned, because there's the orthopedic aspect, which is bones and fractures, but closely aligned with the bones is the tendons, the arteries, the nerves. So it's often a crush injury, a fracture that involves the bones, and to break a bone, you usually injure one of those other things. So combined with tendons and arteries and nerves, and that's one of the reasons hand surgery actually was a combination of plastic surgery, general surgery, vascular surgery, neurosurgery back in World War II, and that's where hand surgery came from. So that's the type of injury, combination, work-related, machines, rollers, things like that.
And so when the patients come into the emergency department, are they, are you usually able to salvage, you know, if they have a crushing injury? I mean, you take them to the operating room. What usually happens to those patients? They usually
do well, and you know the hand has a great healing potential, and a lot of times these mangling injuries look terrible. The patients say it looks terrible when they came in. The ER doc says it, but actually once we get them in the OR and start putting things together, we usually can you know, make it function better, look a lot better, and again the hand heals very well. So luckily, most of the times they're not as bad as they look.
Wow. And if we didn't have this hand center, what would happen to patients? I mean, it's a problem. It could be devastating, right?
It's a problem, you know. And before we had the hand service, I remember, you know, phone calls when I was at, you know, another hospital. Phone calls trying to transfer. The orthopedic docs were trying to cover, and they did the best they could.
Right.
But it's oftentimes a whole evening of an ER doc making phone calls trying to get somebody to cover it.
Wow. Well, that's amazing. How many hand injuries do you think we see probably in a year at the medical center?
Yeah, it's, you know, I would say on a daily basis, we probably get, you know, 2 to 5 injuries a day. And some of them are minor, but there's still, even a minor injury in the hand can be, you know, can become a problem if not treated properly. So, you know, 2 to 5 a day times 365, it adds up.
Wow. So we're going to come back in a couple minutes and talk more about hand surgery and maybe talk a little bit about some of the elective things that you do for people who have hand injuries. So we'll be back in a couple minutes.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Welcome back. My name is Joe Scott. We're here with Dr. Capo with the Medical Center Show. And we're talking about orthopedic hand injuries. So we were talking a little bit about what some of the common injuries are with hands and some of the things we see in our emergency department. What about sports injuries? You see people, on sports teams. There are times of the year when, there seems to be a certain kind of hand injury that comes to our emergency department, and how do we treat those?
Yeah, it's sporting injuries are frequent in the hand, and everybody thinks about the knee and the ACL, and that's common too. But the hand often gets involved with sporting injuries, and it's really year-round because summertime, the trauma and some of the sporting injuries are more frequent, but wintertime, fall time is basketball, and basketball is a frequent injury for hand. People try to grab the ball, break their fingers, dislocate their fingers. I saw several people this week in the office that had those injuries. So it's really throughout the year. Probably the traumatic injuries are more in the summer, but it's frequent. Many sports that have hand injuries: baseball, basketball, lacrosse.
And we're able to take care of all those at the medical center now.
Yes, of course. Yeah,
that's great. One of the things that we see a lot are all kinds of orthopedic trauma injuries, and we were talking a little bit about what happens when patients have these really severe crushing injuries, and a lot of times you have to do a flap. Talk a little bit about kind of what that entails and how do you get involved in that?
Yeah, that's I think that's a great thing that we've brought to the medical center. So it's interesting when people talk about a hand surgeon. You say, what does that involve? So first of all, and I'll just digress for a second. The hand surgeons are really upper extremity surgeons now. So I do a lot of elbow, I do shoulder, and I do all the nerve and tendon work in the arm. But also, the nerve and tendon work evolves into microsurgery. So that means if you were unfortunate enough to cut your finger off, I would put it back on and I could use the microscope to sew it on. But that carries over to skin grafts and flap coverage. So if people have traumatic injuries, which you see a lot of in the lower extremity, and there's open wounds in the tibia, which is the shin bone or the femur, and we can't close those, then we have to put some kind of tissue in there. So either a skin graft or even a muscle. I can rotate a muscle into the defect or take a muscle from another area and do microsurgery. A big muscle from the thorax, the latissimus, is often used to bring it over.
Wow.
So
you actually transplant that muscle from somebody's back onto their leg because you can't close the wound.
Correct.
Wow.
Yeah, we call it a free microvascular tissue transfer.
Wow. And those are usually successful? I mean, what are some of the problems with trying to make that work and make sure that the patient recovers well?
Right. Yeah, they usually are. And for a free tissue transfer, the success rate's about 90%.
Okay.
But the good thing, I've done a lot of them. We're good at that. The good thing is because of other evolving technologies, I don't have to do the big muscle transfer as much. I can do local transfers, skin grafts. There's some biologic things that companies are making actually in New Jersey that I've used as tissue replacement that helps. So we can avoid the big transfers if needed. But if we need them, we do the muscle transfer.
Right. Now, you talked a little bit about if someone has their finger cut off, you actually sew it back on. And does it function? I mean, once somebody cuts your finger off, how does that work? I mean, you would think they cut it off, it would never work again. Yeah,
no, it can. And the nice thing about the one nice thing about if your finger is cut off, there's not a lot of muscle in your finger. It's tendons, the nerves, and the arteries.
Right.
So if I can get the bone to heal. And it's a lot of kind of mechanical hooking things up, the tendons and the tendons on both sides and the nerves and the arteries, and if we get through that initial period of it's pretty much a week that it survives,
right,
then people get function, and they get good function. Their sensation comes back. It's not normal, but we call it protective, so they can, they don't burn their finger.
Right.
And then, there's other procedures I have to do down the line. If it heals and the bone heals, but it's stiff, I can help it move by doing some other procedures.
So when you do that, how can you see what to connect to what? I mean, you have special equipment, and does that take a long time? What's it like in the operating room when you're doing that kind of work?
Yeah, that's a great question. That's the tricky part, is to find out which end, which goes to which. And I think that's we learned in our fellowship and residency, and it takes time. And it's interesting that if people have a laceration down by their wrist, or their hand is off at the wrist, the moniker that people use is a spaghetti wrist, because the tendons are so. Oh.
It looks like spaghetti coming out. Really.
But it takes time, and you really have to be systematic and find obviously what's attached on the proximal side and the distal side. So, and for the fine things, the microsurgery, we use a microscope, and you know, we really need.
So you're really looking at kind of the microvascular, and you actually sew that back together. These tiny, tiny vessels that you
have to sew it back together. And the critical thing.
It must take forever.
Sometimes.
Really?
Sometimes. It takes a long time. But the tricky thing is to get the little blood vessels together. Right. So, you know, the tendons, we get them together, but the blood vessels in the finger are about 1.5 millimeters. Sure. So we really need the microscope to make sure that the two tubes line up and the blood flows. And even after, if it's done perfectly, still that can clot off. So we have special nursing teams, blood thinners we use, so it's important to keep everything open.
So when I was a pharmacist, way back when, we used to use leeches, and they would put leeches on these wounds to try to keep the blood flowing, because I guess they have some anticoagulant in them. Do we do that still, or we don't have to do that anymore?
You know, we still do that at times.
Wow.
And and I always say it's amazing that we have, you know, we're very advanced. We have lasers, we have robotic surgery, but we still go back to plaster casts and leeches, because you know, we've learned a lot, we know a lot, but there's certain things we haven't figured out. So and they're medical grade leeches, they're through the pharmacy, but it's and sometimes we need them and they work. And it's, if the blood flow is going into the finger, and actually the veins are the hardest things, because the arteries are small, but the veins are so small and they're collapsed.
So the artery takes things away from the heart and the veins bring it back? Is that
right?
So why, you know, why is that a problem with the veins?
Well, the arteries bring in the blood to the finger, and actually, if we need the leeches, the finger looks swollen or congested, but the blood flow coming out is not as good as it should be. So the leech actually brings the blood out, as you said, and then actually it enters a substance, hirudin, that actually promotes blood thinning. So it works, and I've had several fingers that are kind of, you know, hanging in there on the fence, and the leeches have
what cured them.
Pulled them
thank
through.
God for the leeches.
Yeah.
I remember the first time we got them, we couldn't figure out where they were coming from, and we found some farm in North Carolina that made medicinal leeches. So it was
it's a hard sell to the patient.
Yeah.
You know, you have to, and you explain it, but you know,
just close your eyes and forget that there's a leech on your hand, right?
Right. And you know, to save their finger, they're willing to go through it.
Right. We talked a lot about what happens in the ER and with trauma and all the different kind of cases that come to the medical center, and we have. Everybody always says the pathology at the medical center is always something that they don't find everywhere in the country. But you also do elective stuff.
Sure.
So you have a regular office on the campus of the hospital.
Yes, I do.
Tell us kind of some of the things that you see in your office.
Sure. And it's nice that, you know, that the medical center has a campus. So I'm in the building behind the, you know, on the campus with the surgery center. And it's nice to be able to walk to the main hospital, do big cases, and go back to the surgery center. So, yeah, I see patients every week, and it's most of the patients are people that have chronic problems. And it's a nice mix. I'll see the people with chronic problems and the people that had the big traumatic injury that are coming in for follow-up.
Okay.
So typical things are carpal tunnel, you know, nerve injuries, nerve compression, carpal tunnel in the wrist. Sometimes people get cubital tunnel at the elbow, arthritis, tendinitis, muscular problems. People have fractures that didn't heal from years ago. So there's many chronic issues in the upper extremity that I see.
Okay. We'll be right back. We're going to talk a little bit more about some of those hand-related injuries with Dr. Capo, and we'll be back in a couple minutes.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. For patients, not for profit. Visit us on the web at libertyhealth.org.
Hi, I'm Joe Scott. I'm here with Dr. Capo, and we are talking about orthopedics and in particular hand. But Dr. Capo, we were also talking about other things that you do. You said that you pretty much treat from the shoulder down, and tell us a little bit about some of the things that you do outside of the emergency department.
Sure. And as I think I mentioned earlier, we call ourselves upper extremity surgeons, and it's really, you know, more from just a hand surgeon and up to the arm, you know, the upper arm. So fractures, I will do all fractures, and I take general call just to be involved. But my main elective practice is really clavicle, so even past the shoulder, clavicle, and then people, all the nerves that go into the hand actually come out of from the neck, and we call this the brachial plexus where the nerves are, then come down. So all the way from the clavicle down is the scope of practice that I look at. And
so when I was a kid, I fell off my bunk beds and broke my collarbone. So you would have been able to take care of that, right?
Sure.
Yeah,
sure.
yeah. Do you see kids doing that kind of stuff now?
We see you know, many children in our practice, and our practice is you know, we talk about age groups. We see I actually see babies, you know, what I was going to say, from children to, you know, 80 years old.
Right.
And I would see the infants or young children for congenital hand deformities, kids that have their fingers stuck together, syndactyly we call that, and you know, there's actually more complex injuries such as, or malformations such as a duplicate thumb or a child without a thumb.
Okay.
And we can actually, this is actually what got me into hand surgery. I saw a guy, a doctor, it's called policization, actually make a thumb out of the index finger. So some poor kids are born without a thumb, and they do okay, but if you don't have the opposable thumb, it's a problem. So we actually take the index finger, and in an elegant surgical procedure, shorten it, rotate it, and make it like a thumb.
Like a thumb.
So it's a 4-finger hand, but it functions much better.
Wow.
So that's one.
Wow, that's really amazing. That sounds like it's a really involved surgery.
It is, but it's predictable, and kids really do well. So the goal is to get them when they're young so they can learn how to use that hand when they go to school, even preschool.
Right. The shoulder injuries, you take care of the shoulder also. So what kind of common shoulder injuries do you see? A lot of sports-related stuff?
I do, and even just arthritis and chronic shoulder problems.
Right.
I think I read a stat somewhere that the second most common ailment for an orthopedic practice behind low back pain and injuries is shoulder pain. So there's young sporting injuries, throwers, pitchers that have problems, and I'll see some of those. But if it's somebody that's really a high-level athlete, my partner, Guillaume Lomas, is a sports medicine-trained physician who really works with the trainers and you know, the schools around the area for that. And he actually did his fellowship at the, you know, arguably the best fellowship in the country in Los Angeles. So it's nice. I'll see the shoulders. If they're more of a chronic thing, I'll take care of them. But I'll send him the pitchers and throwers that, you know, want to play for the Yankees.
Wow, that's great. Now, your practice is in the medical office building on the campus of Jersey City Medical Center, right there on Grant, right across from the light rail, right? And you have Dr. Lomas. Who else is in your practice?
And Dr. Frank Liberace is my partner, who's an orthopedic traumatologist who specializes in complex fractures, especially of the lower extremity, and also total joint replacement.
Okay. They all are on faculty at NYU?
Yep. Yes, they are. We're all on faculty, which is nice, and we all work together.
Right. The Dr. Lomas, you said, does sports-related injuries, and does he see, what kind of things does he see in our community?
You know, he sees all types, and it's interesting when you talk about, you know, an athlete. There is the elite level, you know, pro athlete, which, you know, he is treated. Right. But then there's the weekend warriors, you know, guys like me that, you know, can injure their ACL or, you know, a lot of people. Last week I know we saw somebody that ruptured their Achilles tendon playing basketball. Yeah. So, you know, everybody is a different grade of athlete, but, you know, everybody these days wants to get back and, you know, be at top level. So, you know, we understand that and treat them all appropriately.
Now, Dr. Liberace is kind of a unique doctor in that he's fellowship trained in trauma, right?
Correct.
So he's an orthopedic surgeon who's fellowship trained in trauma. there's not a whole lot of those even in New Jersey, right? We're unique in that we have somebody with his expertise at our hospital.
Yeah, that's correct. I think maybe 3 or 4 docs in the whole state are traumatologists.
Right.
And that's his specialty is complex fractures, again, mainly the lower extremity, but he's very good at the upper as well, and we'll do cases together, which is helpful. And a difficult fracture is the hip joint or the acetabulum, which there's only a few docs around that do that. And even the traumatologists, some of them don't do that surgery. They don't do that because it's very complex. So he's really an international world-class specialist, as I think we all are, which is nice to bring that to Jersey City.
Yeah, yeah. It's amazing that we have this level of expertise on our campus in Jersey City, which really up till about 7 or 8 years ago, we really didn't have this kind of coverage for our hospital. So the fact that we're a trauma center and we have your expertise really makes a big, big difference in how patients are treated at the medical center. That's really pretty amazing.
I agree.
Now, you talked a little bit about arthritis. You see a lot of arthritis in your office?
I do. And there's different types of arthritis. There's everybody's going to get arthritis. We're all going to get wear and tear osteoarthritis. So I see a lot of that. I used to see a lot more of rheumatoid arthritis, but the rheumatologists are so good now. We see less people that require operative treatment, but I still see those people that have had arthritis since they were a kid, and then they get joint deformities, and there's classic joint deformities of the hands with deviation of the fingers, and we really can help them out a lot. So yeah, many types of arthritis.
So somebody who's had arthritis for a long time, their hands actually become deformed. You can do surgery on that? I didn't realize that.
Yep, that is correct. And again, the medications help us, so less people need it. But there's joint replacements. We all know hips and knees and hips, but there's actually an elbow joint replacement that I do a lot of. There's wrist replacements and finger joint replacements that are helpful.
So you actually replace the joint for the fingers even now? Wow, that's pretty incredible. That's really an expertise that's not available in a lot of different places. So you treat everything from young kids up to the oldest folks with rheumatological type disorders. Anything else that you see in your practice that's kind of unique to Jersey City that really wouldn't be able to be seen anyplace else? You talked about elbow injuries and elderly people who fall. You see a lot of that? We do. We see a lot of fractures, and it's nice that we all work together. And there's even another unique thing that Frank, Dr. Liberace, and I do together for people that have avascular necrosis of their hip. Some people, their hip joint, for some reason, collapses when they're young, and it's a lack of blood supply. So if somebody's 20, 25, we don't want to do a hip replacement. So there's a procedure that was developed that we take the fibula bone, the little bone, from the leg as a free tissue transfer with the artery and the vein, and bring it up here and hook it up. So we'll do that together. I'll take the fibula bone, and Dr. Liberace will put it into the hip, and then I'll hook up the little vessels. Wow. So that's really unique. That's unique. We're here with Dr. Capo. We had a great conversation about orthopedics and the wonderful work he does at the medical center. We're so happy to have you as our director for our hand program at the medical center. And we'll be back next week with a whole host of doctors to talk about great things at the medical center.